Hello, welcome to our webinar today on addressing health and environmental impact assessment. My name is Bridget John and I will be your moderator. Today's webinar is hosted by the International Association for Impact Assessment, or IAIA. We are the leading global network on best practice for using impact assessment to make informed decisions. Today's webinar is part of a series of webinars offered by IAIA, and I invite you to visit our website and check out our recordings, a few of our more recent ones. You'll see a variety of topics there. We've covered gender, emerging technologies, biodiversity, indigenous voices, and many more. So I invite you to visit the website there. The URL is on your screen. And if you feel inclined to tweet today about our webinar, you'll see our Twitter handle and a hashtag IAIA webinar on the bottom of your screen there. Before we get started, we have just a few bits of housekeeping for you. You'll see on the right side of your screen a control panel. There's an orange or red arrow that you can use to minimize the control panel or pop it back out again. We are recording the webinar, and so we will make that available to you all afterwards. There will be time at the end for questions, so please enter the questions at any time in the control panel on the right side of your screen. Slides are available in the control panel under the handouts panel there, and we will also make those available to you at the end as well. Now, let me introduce our first presenter. Francesca Vigliani is the Director of Public Health and Co-Head of Sustainability at International SOS, the world's leading medical and travel services company. She is a Chatham House Fellow and a specialist in public health and crisis management, with over 25 years of work experience in several countries. At International SOS, Francesca oversees the delivery of Health Impact Assessment, or HIA, and public health programs worldwide. And now, Francesca, I will turn it over to you to get us started with an overview of the position paper and its drafting process.
Thanks, Bridget, and thanks to all the listeners today. I will start to give you some background information on the paper and the drafting process so that you can better contextualize the content whilst we go ahead. The paper has been jointly drafted by a group of experts, health impact assessment and public health practitioners from both organizations, the International Association of Impact Assessment and the European Public Health Association. You can see the names on the table in the slide. The process has been supported by the WHO Regional Office for Europe, which convened a workshop earlier on this year, inviting representatives from all the member states, as well as from the European Commission and from other European agencies, to discuss on a concept note that we drafted together. The paper was then further presented at the UEFA conference in Marseille just a few weeks ago. We are now having this webinar, and then we have to develop a survey. You can find a link on the slides that will be open till the 6th of January. And we really encourage all the participants today and everybody who is a health impact assessment, environmental impact assessment practitioner to go to the survey to provide your answer and your comments. The document, which will include all the comments we received during the consultation process, will be finally launched at the IIA conference in May 2020 in Seville. Now, what is the aim of the paper? Health has always been part of the environmental impact assessment within the European Union in some form and in some sort. However, the focus has always been often on biophysical parameters, things that can be relatively easily quantified and fit better the environmental approach. The aim of the paper is very much to ensure a consistent coverage of health within environmental impact assessment, within the European Union, but also beyond. Multiple governmental department, authority, as well as diverse type of actors like project proponent, communities, experts, and civil society organizations come together in the environmental impact assessment process. These groups have often diverse competencies, but are also driven by a different set of incentives and can have different expectations from the impact assessment process. The paper provides principle and good practice to foster this cross-collaboration. So as we go through the presentation today, I would like you to remember that certain aspects that might be very clear and familiar to you might be new for other listeners. And this will be the same in the impact assessment process. For someone, scoping is a very clear task, while for others, linking the pathways between air pollution and heart disease might be much more familiar. So the paper was just to provide a common language that facilitated discussion between different groups. Is also further contribute to work that has been done by both organizations. You can see there is another publication we have developed in the past about health in different forms of impact assessment. And again, the aim was to foster discussion and cross-collaboration. It finally also contributes to strategies to reduce the burden of environmental-related disease, as evidenced by the work done by WHO on healthy environments. So why we think is important? Well, you can see on the top of the slide the definition of health that has been provided by WHO. This is from the preamble constitution of the organization, so it's from 1946, and it's still valid today. The first part, and the definition is divided into two parts. The first part emphasizes how human health encompasses mental, physical, and social well-being. We know that health is affected and affects also environmental, social, and economic factors. These factors are known as determinants of health, are often under the control of other sectors, not the health sector, and the public health authorities or department are the part of the health sector that deals with different other institutions or departments to ensure that health is protected and eventually promoted. The second part of the definition emphasizes the importance of addressing and treating disease and infirmity. This is the role of the curative part of the health sector, but both of them need to come together to prevent and promote health. The figure you see below is a kind of description of all the sectors and determinants of health that are important to consider. Health for us is a positive concept that can be produced and promoted. Next slide. We talked about environmental related contribution to disease, and this is very important. According to the latest data from a WHO research, around 23% of global deaths, so in 2012, 1 in 4 deaths were attributable to environmental factors that could have been modified. So this could have been prevented deaths. And the number is even higher in children under 5. And we also have to be clear that this is not something that is only related to low and middle income country. The type of disease might be different, but the burden is across all countries. So it's a common type of problem. So what are the environmental risk factors that affect human health? And we can move to the next slide. These factors are many and are different. We can expose to factors at home, at work, during transport, or in public places. Adequate environmental, urban, and transport policies, as well as sustainable agriculture and food production, and safe working conditions can prevent or strongly reduce many of these disease factors. Yet, we have seen that environmental conditions are still contributing to 1 in 4 deaths worldwide. And this is why the work of including health in environmental impact assessment we think is important. So just to provide some definitions as we go then along to look more in depth at the content. What is health impact assessment? We can define health impact assessment as a combination of procedure, method, and tools. It systematically judges the potential effect of a policy, plan, program, or project. So health impact assessment can be conducted at different levels. It's also to identify what are the unintended consequences of any proposal. It looks both at the health of a population as well as the distribution of those effects within the population. So it's not only a question of health outcome, but also how these are distributed across different groups. And identifies appropriate actions to manage the effect. The important part also of health impact assessment is that it doesn't focus exclusively on the negative dimension, but it's also look at the positive impact. So the recommendation needs to not only focus on avoiding or minimizing, but also enhancing positive outcomes. So what is environmental impact assessment then? Well, environmental impact assessment is the form of impact assessment that is applied exclusively at project level. It applies a wide range of public as well as private projects. and is conducted on projects that are likely to have a significant effect on the environment. And we will discuss more about what does it mean significant. So environmental impact assessment is not necessarily done on any single project. The type of project that might require environmental impact assessment are infrastructure projects such as airport and motorways, power station, but also extractive industry or urban development, tend to be large type of project. Environmental impact assessment is conducted by the developer as part of the process that is seeking consent to proceed with the project. The review is done by the competent authorities. We will enter in this discussion later on. But addressing health and environmental impact assessment may carry an important way to look at this, at the burden of disease, because environmental impact assessment, as we see, is regulated, while health impact assessment is still conducted voluntarily in a lot of countries. And with this, Bridget, I pass back to you. Thank you very much.
Thank you very much, Francesca. So now we will be hearing from Odile Michel. Odile is head of the Division of Healthy Settings at the North Rhine-Westphalia Center for Health, or LZG-NRW, in Bochum, Germany. LZG-NRW is a governmental institute giving advice to the NRW Ministry of Health and to local health departments. Odile is president of the section on health impact assessment of the European Public Health Association, or EUPHA. Her main interests are health impact assessment, including quantitative approaches and local and regional healthy public policies. Odile will give us a background on the European EIA Directive and present principles for health within EIA. Over to you, Odile.
Thank you very much, Bridget. Hello, everyone. So I will talk a bit about environmental impact assessment regulation in the European Union. Next slide. So environmental impact assessment is governed by the European Union by the Directive 2011/92/EU, and this directive was amended in 2014, and nowadays we talk about this directive. And the key changes in this amended directive is that under the scope of the covered environmental factors, it replaces human being by population and human health. So now human being is replaced by population and human health. And in line with other topics, the directive does not provide definitions for population and human health, nor does it specify methods for assessing the likely significant effects on human health. So on the next slide, you see the formal text of the directive. And what I wanted to point out is that it states that it contributes to a high level of protection of the environment and human health. So it is the way in EU how we do regulate environmental impact assessment. And as already stated earlier in Article 3, the factors that need to be covered are listed over there from A to E. And it's the first factor, it is population and human health. And also in E, it is said that all these other factors also need to be considered, and also the interaction between these factors needs to be considered. And additionally, in the sentence 2, the vulnerability of a project to risk or major accidents and/or disasters are also part of this directive. So what Francesca earlier already said, so environmental impact assessment is a legal requirement for certain types of public and private projects that follow a structured process. It informs and supports an application for consent to proceed with a project. And health in environmental impact assessment requires cross-sectoral working by both the developer and by the competent authority to ensure that the health sector is involved. So earlier we said nowadays it is human health, population and human health in the new directive. But what factors does environmental impact assessment cover? So population, human health. In the paper we produced, and which is now for consultation, human health, we define human health as the WHO definition, which was shown earlier. And this definition has two parts. The first part emphasizes how population human health spans environmental, social, and economic aspects, as you can see on the right side of the slide, and how encompasses mental and physical health. And this is the role of public health. And the second part of the WHO definition emphasizes the importance of addressing and treating disease and infirmity. This is the role of healthcare. So that's not part of the environmental impact assessment mainly, but the first part. Population is also now mentioned in the directive. This can include consideration of economic impacts such as local, regional employment and expenditure opportunities, and social effects such as the impact of construction workforce on local services and the impacts of quality of life and well-being issues, often reflected in social problems such as crime, poor health, community stress, and conflict. This proximity of population and human health in this article is of note, as these topics are closely linked. In the context of environmental impact assessment, human health and population are two distinct yet interrelated factors that need to be addressed. Additionally to these factors said before, we defined also principles for human health consideration in environmental impact assessment. So we need a comprehensive approach to health that's in the center of our considerations, and good practice in addressing human health and environmental impact assessment is that the public health perspective, which is underpinned by these four other principles: equity, transparency, proportionality, and consistency. More about these principles are laid down in the document, and we can discuss later on. What is also important, who can conduct a health assessment within environmental impact assessment. The directive requires that competent experts should prepare the environmental impact assessment report, and the competent authority which reviews the report should have access to sufficient expertise to examine it. This includes also health assessment parts. The health sector has a duty to develop and/or acquire the required competence and skills to meaningfully contribute to the process. Those leading the human health assessment component within environmental impact assessment should demonstrate that they meet the necessary requirements. These technical competencies and the means of assuring them have not yet been widely specified. Guidance exists for reviewing completed EIA reports, and this advice can aid the review of a health sector within environmental impact assessment reports. The health sector can provide environmental impact assessment consultation input on health outcomes, pathways, effects, mitigation, and monitoring. National and regional health authorities should play a significant role in reviewing environmental impact assessments. It would be desirable to see public health experts which have a deep understanding of both the health and the environmental sector. The directive requires competent expertise to assess human health. These comprise of soft and hard skills. In the paper, which is for consultation, we also have good practice actions that can be done by different persons. So, for example, we state that the health stakeholders should support the developer and competent authority in understanding the health competence requirements, articulate expectation about soft and hard skills required for valid assessment of health effects, but also the developer. We defined good practice by the developer in establishing the competence of those producing the report, ensure that a competent health expert is included in the team of consultants as appropriate. But also the Competent authority should establish the competence of those reviewing or examining the report, clarify requirements for experts competent on assessing the human health effects, and enforce such requirements when appraising the reports. Thank you very much.
Thank you so much, Odile. Some great presentations so far, and now our final speaker is Ben Cave. Ben has specialized in impact assessment in health for 20 years. He's worked across the UK and mainland Europe and further afield with industry and government, as well as financial institutions and United Nations organizations. Ben will dive more deeply into the EIA report itself and discuss intersectoral cooperation. Over to you, Ben.
Bridget, thank you very much indeed. So we've been working through the report, and as I think both Francesca and Odile have said, we would very much welcome your comments on this. And the survey has been set up to enable you to structure your comments and hopefully make it easier to provide them. In the 10 minutes that I have with you, I'll talk about the EIA process a bit more. This diagram we use in the document for showing in the middle column shows the environmental impact assessment process and how this is usually carried out by the developer with a range of stages which will be familiar to those of you who know about impact assessment. So I'll run through those stages in the next few minutes. And just alongside that, we have on the left-hand side the consent process. So this is intricately linked to the process of getting consent for a project. And on the right-hand side, various opportunities for engagement in EIA. And this, of course, includes opportunities for public health expertise to be brought into this process. So we'll consider that as well. So if we move on, the first stage is screening. And as you can see, it says screening is not mandatory in EIA, but it is the process that is used to determine whether an EIA is or is not required. And what we have tried to do in this document is to spell out in what we hope is a useful level of detail, the requirements of the EIA Directive. I've spoken in other forums about how sometimes as a public health person, it can feel like you're coming onto a stage with lots of other actors when you're doing environmental impact assessment, that everybody else knows their lines and everybody else has the script that they should follow. And that we are trying to elbow our way in and introduce a new topic into the discussion. So the EIA Directive sets out a process that must be followed, and there is good precedent for that in different member states about the ways in which environmental impact assessment is conducted. So the document that we have prepared aims to walk the health sector through those stages and make it clear what needs to happen. So an important term, which other speakers have mentioned already, is the term likely significant effect, and this is introduced at this stage. And at the screening stage, really we can be dealing with a very relatively little information about the project. So we are looking to say, with a simple yes or no answer, is there a brief justification as to why health should be considered or whether it can be taken out of consideration. So in the document we provide ways in which you can work through that, and we have through the document some good practice actions which I'll come on to in a minute, and then also at the back of the document there are tables which are developed from the tables in European Commission guidance, and we have highlighted questions which are particularly important for human health, and where appropriate, we've added one or two in. So as we see here, screening, the level of detail may be low and the level of uncertainty high, and then we're we're looking to find ways in which population health outcomes are of key importance. And you can see the steps which are set out below, so steps 1 to 4, and ending up with a screening decision and its justification, so that the competent authority can say what is required. Okay, so we can move on to the next slide, please. The good practice actions, I've provided some of them. I haven't gone into them all in great detail, as time would be against us for that. But again, on this slide, you can see that what is clearly important is that we're trying to make aware the developer that they should look to bring those with public health knowledge into the process. Likewise, the competent authority should seek relevant public health advice, and that the competent authority should also feel confident in using health information when deciding on the final justification for the screening point. Scoping also is not a mandatory step in EIA. Although all authorities and all practitioners will agree that scoping is good practice, and it is a very important stage in all forms of impact assessment, as it enables better planning and costing of the assessment stage, and thus reduces the risk of delays further on down the line. So also this is where the dialogue starts very much. So from a health point of view, we are saying that scoping needs to determine the potential for population health effects to be both likely and significant. And that if this is the case, then these issues should be scoped in for further assessment. Now, another important change with the amended directive is the focus on proportionality. So we are saying, we're not saying that all aspects of health should be scoped in, but that we need to be proportionate in how this is done. And we provide steps in the document in which we can do this. And I think it is very important that health effects that are unlikely to significantly affect population health should be scoped out. And that can feel quite scary at scoping stage. Quite often the temptation is to put all the topics in just for good measure. But really there should be justification for scoping things out as well as scoping them in. And once again, good practice is to consult health stakeholders. So the steps which are covered in the guide are provided below as well. And this will conclude with the developer will produce a scoping report. And then the response to that will be the scoping opinion from the competent authority. And these are important stages. And once again, it is important to involve public health stakeholders in this process. It's quite easy for working in public health to be not to be aware that these processes are taking place. So again, we have the technical requirements of the directive all the time. It's important for the links to be made across sectors. Once again, we have a range of good practice actions. They focus on the importance of cross-sectoral action and the importance also of what should, so not just establishing a link, but what should form the discussion. So if we go down the list there, the fourth recommendation is about supporting the developer or competent authority to establish a proportionate health scope with reference to a transparent and consistent process for determining the potential likelihood and significance of health effects. And once again, the document aims to walk you through that. We also say we recommend the use of a health chapter so that the health issues are brought to the fore. Again, this makes it easier for health stakeholders to take part. We also recognise, given the cross-cutting nature of health, that this will draw on some of the other chapters in the EIA report, but it's, again, important to start establishing that. So next one, please. The EIA report or the assessment, again, This is where we really focus in on the likely significant effects of the project, including for health. The framework that has been presented in this document seeks to be applicable to all types of health determinant. So we have seen earlier, shown by both Francesca and by Odile, different diagrams for showing how health is conceptualized, or what goes together to make up health. And we need to find in this document a way which can be adapted to things which are amenable to quantification, such as air quality and noise and water quality, and also factors which are less amenable to quantification, such as social cohesion or other aspects of social determinants of health. A key point also is that EIA takes a population health approach. We define this term in the document, and there is some scope for confusion here, because obviously the terms population and human health come closely together in the directive. And then in public health, there is a concept called population health. So there is plenty of room for confusion there. But the difference to this is that we are looking at the health of populations. We're not looking at the health of individuals, and that's clearly an important distinction to be able to make. As we're looking at this also, inequalities are a key feature of the health assessment. So we strongly recommend that that findings or conclusions in the assessment stage are made both for a general population and for vulnerable groups, so that this issue of health inequalities can be considered and brought to the attention of the competent authority. This is really the main part of the assessment, obviously is building towards this. So the different aspects which we cover in the document are the importance of the project description, where we have a full description of actually what the project is looking to do. And this is clearly important because it then begins to establish what the pathway to a likely significant health effect might be. We have the health baseline scenarios, so who are the people who will be potentially be affected, and what environmental factors will come into play. We work through about assessing the effects on the environment, including of human health. And again, as I say, we provide this framework which can be modified, but it is adaptable and flexible for all of the determinants of health. We look at mandatory assessment of alternatives, and also importantly mitigation and compensation measures. And this is where those with a background in health impact assessment, it's clearly of interest, and where the plan for managing health effects comes in. And in, I think, the experience of the people contributing to this document and other practitioners is that EIA has a bit more bite, a bit more legislative weight than health impact assessments can sometimes do. And so the mitigation and compensation is a big opportunity for real changes to be suggested and for tweaks to the project design, but also ongoing measures for addressing issues to do with population health. And then clearly monitoring is important as well. Not to be dismissed, it is very important, but I'm conscious of time. So moving on, please. In again, some good practice actions here. The first one talks about health services. Odile mentioned that health services are not typically part of EIA, and I entirely support that view. We have a recommendation here because sometimes health services may be affected. There may be a large construction workforce coming in. It might be a housing development where there will be an influx of population which might be in advance of any funding for health services. Again, this will differ across different member states, but we have put some thought in about this is something which health stakeholders may want to consider, and how to make this point to both the developer and the competent authority. Points around the health baseline also, which is clearly important, and this will go forward into monitoring, and then the importance of setting the EIA policy context. So if we move on from there, please. We also have, again, just thinking around general wider policy around that health stakeholders can begin to be aware of development projects and to factor this into health policy as well. And then the importance of this a consistent way of looking at the significance, likely significance of health effects. And I would direct you to the framework in the document, which I think it's a table 3, I think, from memory. But again, it shows the different types of information sources which can be used, which would tend to be used, but also we're trying to set them out in a systematic way towards thinking about how significance can be worked out and a judgment can be reached. We also recognize that things around importance, desirability and acceptability come into play in the discussions. So we set out that thinking as well. Next slide, please. So just consultation. This is a requirement of the directive. It's important both for consultation with other authorities, so bringing health authorities into the discussion is clearly important. Also consulting for members of the public, and this is clearly important, and we can trace the heritage of this also back to health impact assessment, which places a great premium upon consultation, so that people have a chance to talk about what they feel is affecting their health and their views and hopes about particular projects. Okay, next slide, please. And then just finally, to wrap up, once again, monitoring is of great importance, and as it's a requirement of the directive, there will be requirements placed upon the developers, and this is an opportunity for public health outcomes or indicators to be monitored and tracked through. Now, it's actually, as I said, public health outcomes. It is very difficult to track public health outcomes, so I think we're not necessarily looking at setting up bespoke monitoring regimes, but we would more likely to be looking at using existing public health indicator sets. Again, it's both a link through in terms of data, but also longer term involvement of public health authorities in how to interpret that monitoring and what should be done if things aren't going as they were hoped. So again, and this plays into the mitigation and compensation, which we talked about earlier. I think that's it for me. There we have some next steps. I'll just close up here. We welcome your questions and discussion. We please request you to, I know the timing isn't great in terms of calendar months and we're coming up for Christmas, but we very much welcome your comments on the consultation draft. We will then edit the paper. We also, I think there's a note in there saying that we need to prepare case studies. I think this will help illustrate some of the points. And so if you have ideas for case studies, we would welcome those. We have a few in mind, but please do help us out if you've got some thinking there. And then the intention is to have a final paper that we can launch at the EIA conference in May 2020 in Seville. And I hope that everybody who's on the webinar is able to attend that conference, because it would be lovely to see you. Thank you very much.
Fantastic. Thank you, Ben. Those were some great presentations, Francesco, Odile, and Ben. And now we're going to open it up to questions. And to do that, I would like to introduce our two facilitators who have been busy during the presentations reviewing all of the questions you've been submitting, and will be posing them to the speakers. So I will ask Ben to turn off his webcam, and we'll have Sarah and Brigitte turn theirs on so you get to meet them. So first, I'd like to introduce to you Sarah Humboldt de Kruiden. Sarah is currently pursuing her PhD in global studies at the Roskilde University. She is focusing on the One Health approach and its policy processes and institutionalization within the European Union. Sarah has a master's in public health from University of Southern Denmark, where she specialized in global health and put a focus on health policies within the European Union, as well as practical approaches such as HIAs and EIAs. And joining her is Brigitte Fischer-Bonde. Brigitte also has a master's degree in public health from University of Southern Denmark. Her master's thesis was about health in environmental assessments. Brigitte is a co-author of the position paper we're discussing today, and she's currently working as consultant at Fischer-Bonde Consulting with assignments within the cross-field of risk and human health. So Sarah and Brigitte, it's great to have you with us today to moderate all of these questions. I'm sure they've been coming in fast and furious. So I'm going to ask the panelists to turn their webcams back on at this time and unmute their microphones. And I'm also pleased to introduce a special surprise guest who will be participating in the question session as well. So let me introduce her at this time. Julia Novacki works at the World Health Organization's European Center for Environment and Health since 2008, first in Italy and currently in Germany. She specializes in health and environmental assessment. So, Sarah and Brigitte, I think you've identified a question for Julia, so why don't you go ahead and get us started?
Yes, thank you so much, Bridget. And yeah, our first question goes to Julia. And so we have heard about the various good practice actions within the draft paper. From your point of view, what would be needed to get health authorities more involved within EIAs? And what could the WHO do to further support these efforts?
Well, thanks a lot for this question. But first of all, thanks a lot for this webinar and also for the chance for us as WHO to have a say on our position here. So from our side, we're working in this area, health and environmental assessment, since many years. And we're still lacking, especially now, the real good guidance things which brings together the different silos we unfortunately still have between the health experts and the environmental experts. So I think this document, which was just presented, is a very nice chance and opportunity to bridge over these silos again. And I think that is one of the most important things that we are here working on, is to make the health sector more aware of the environmental assessment processes. Because most of the health sector or the public health still is more focusing on the health care area, and it's difficult, and with all the burden of tasks they have, to get them also into other areas like the environmental assessment processes, which are in most of the countries, as we heard, legally binding, and health impact assessments only in few countries. So it's important to get the health people aware of what is going on in the other sectors, and what are the chances there to really move and promote health within legal processes. So it's about having good guidance, having trainings, if possible, trainings together. So like we are trying here in our Bonn office to bring together the health and the environmental sectors. And the big thing, I think, is simply about dialogue. Talk to your colleagues if possible, and work together. So that is, I would say, the main message we always convey in our trainings. You need to know your colleagues in the other areas and break down these silos. So I think that's one of the big issues we are still working on. So over to you.
Thank you, Julia. That was a very nice answer to our a little bit complicated question. So the next question we have from Karen from Canada, and she wants to ask how equity is thoroughly integrated throughout the consideration of human health impacts as part of EIAs. And also, what specific roles do varying public health professionals play in HIA and EIAs? And if Odile could answer this question, that would be nice.
I give it a go, I give it a try. One of the principles for considering human health in environmental impact assessment is equity. And if we consider equity in environmental impact assessment, then we consider the distribution of health impact across the population, and to look for vulnerable groups, so specific attention to vulnerable groups. And if we identify impacts that are unfair and avoidable, then appropriate measures should be included to avoid or reduce these adverse health outcomes. Either to avoid or reduce, or to improve health and other outcomes for affected groups. So it is especially for the vulnerable groups across the population that needs to be taken into account in environmental impact assessment. So, and the second part of your question, what specific roles do public health professionals play in HIA or in environmental impact assessment? So what was stated earlier is that public health professions can, for example, be part of the competent authority. So that's one part, but most of the times I would think that they have a role as consultants, so advisor to the developer and to the competent authority. But maybe some of my colleagues could add more. For example, Ben.
Thank you. I agree with that. I think equity is a challenging topic. We have made sure to include it in the principles, because while it is challenging, we also think it is very important. Again, it's partly about, what is very much about tracking through with heritage from a public health approach, and equity is one of the principles that appears in the Gothenburg Consensus document and in the EIA Best Practice Principles paper, which Francesca showed. So again, from a public health point of view, it is critically important. I think from an analysis point of view, we're very good at looking at equality. So we tend to look at numbers and at differences, and we might look at routine statistics and say this population group shows X, this population group shows Y, so there is a difference, there is inequality. We are less good at talking about equity, where we are thinking about fairness and whether something is avoidable. So I think this is something which needs to come through in the discussions, very much about mitigation and compensation, and a very good awareness of what the likely effects a project will have upon a population, and how that can, what can be done at project level, both by the developer and also by different authorities, public health or other. I think as a team, we think this is very important. We also recognize it is quite challenging.
Thank you so much, Ben. And I actually have the next question also for you. And the question comes from Nuncia from Italy. And she's asking that there are recurrent cases about the approval of EIA proposals by the competent regional authority, while there's social opposition, meaning that the community is still concerned about health impacts or health pressures. And how do we deal with that?
That's a very good question. I think there are some ways in which good public health advice can help allay fears, and I say that in the full knowledge of lots of occasions where that doesn't take place. I think there is if communities are very concerned about a project and feel that it is being imposed upon them, then it is very difficult to win back trust through what can be, quite a challenging process. And impact assessments will tend to be carried out on contentious projects where community and other feelings run high. So again, I think the importance of dialogue is clear. that a dialogue can be built up with community groups around what likely effects are, and then the aim must be to have reasoned discussions around what people think the community might think the likely effects are, and what the likely effects are as showing from the scientific evidence base, from what the developer is looking to do, so that there is a dialogue that goes through. I recognize also that can also be challenging and difficult, and I think a role of the health impact of the health impact chapter, the health assessment, is to be as clear and as transparent as possible in presenting this. I think that there might be a case where the assessment has found no significant effect, and communities disagree with that, and then that will be a case for the competent authority to hear the cases from the communities and from the developer, and to come to a judgment around what is the best way forward, and the merits of the different cases. But clearly, you don't, as someone working in public health or as somebody working for conducting a health chapter within an assessment, you don't want to get to a point where there is huge disagreement at the finish line. You want to be able to reach consensus before you get to that point.
I just would like to make a comment, Ben. I think totally agree with you. We have done just some research about health inclusion and environmental impact assessment in Australia, and we found exactly the same type of situation where the communities were in disagreement with the project developer and the competent authority. And I think in this case, looking at the health inclusion in the environmental impact assessment was a very tokenistic approach. Health was mentioned, but conclusions were not necessarily very well articulated. So it became really a confrontational issue, which was also created by a lack of trust in between the different groups. So I think that early inclusion, and when Ben was mentioning the different steps, so start to look at what are the potential issues at the screening phase, and being very straightforward, ensuring the health authorities are involved, is also a way to avoid having this, challenging position at the finish line, as Ben was mentioning, because it's not only about finding a significance; it's also addressing worries from the community side about the project, and dialogue is important.
And just sorry, one point to add to that is one of the criteria for considering significance of a health effect is also, which we have included in our framework, is consultation responses. So if an issue is coming through as being clearly of importance to a particular community, then again, that can be brought in. We think it's important that can be brought into the assessment in a formal way.
Thank you, Ben and Francesca. Francesca, we have another question for you, and that relates to this, but what are the indicators and thresholds used for human health assessments within EIAs?
Sorry, could you repeat the question?
Yes, what are the indicators and thresholds used for human health assessments within EIAs? Okay. Are there any established thresholds and indicators?
Well, I think some of the issues we need to consider is that for, yes, it's a complicated topic. From environmental, if we look at environmental determinants like biophysical issues, air pollution or water or noise, there might be, we can use WHO information and data, or we can use a national legislation. The challenge, and we talk about, is the distribution of the consequences of this within the wider population. So what might be a threshold for a general population might be a different threshold for some of the most vulnerable group. So I think that the issues quite often having a health inclusion is not looking exclusively at the environmental parameters and limiting the analysis there, is also looking at what are the possible consequences and the distribution of this within the different type of group. And while this is a relatively more easier process to do with a quantifiable health risk assessment, I don't know if Odile then has anything to add on this, it becomes, as you can imagine, extremely difficult with social determinants of health, where it's much more complicated to quantify or conduct a quantifiable risk assessment of social measures for which are both, there are different aspects to take in consideration: culture, context, educational level, consequences. So for some parameters, it's easier to estimate the risk. For others, it's much more difficult. I don't know if you want to have any. No. Ben.
No, I think that there can be tensions between different guidelines or level limit values as well. So I think that's important to be aware of that. So some of the WHO guidelines for noise and for air quality will typically be a bit lower than for corresponding in the EU limit values, and so that's an important issue to work through there. But again, I underscore or agree with Francesca's observation that the biophysical aspects typically have clearer values which you will need to meet. And for some of the social aspects, again, I think that comes back to, they are very important social factors, and it comes back to the importance of dialogue between the developer and the different authorities in how we address that and how that's going to be met and then monitored and managed.
Thank you so much, Francesca and Ben. And we have time for one last and quick question. And it's a question that multiple people asked. And it's, are there any overlaps between health impact assessment and social impact assessment taken into account? And I'll address this question to Odile.
So in social and health impact assessment, other colleagues are more familiar. I would say Francesca is the better person to answer this question.
Yeah, I think that there are absolutely areas, I wouldn't say necessarily of overlapping, but of contribution. I mean, what we say, for example, ideally we need to have an environmental, social and health impact assessment. Social are important determinants of health. Quite often the issue is that when we do a social impact assessment, people might not look at what are the health consequences of social impacts. And I think that the issues of health is not that we disregard. We work absolutely very closely together with social colleagues as well as environmental colleagues. I think that the point is ensuring that we look at the health consequences. And then, I mean, we focus at the moment on the European directive. We need to be clear that, for example, in certain legislation in certain countries, health impact assessment might, although voluntary, might be much more widespread than social impact assessment. In other contexts, especially where financial institutions are present, not only the European ones, but multilateral institutions, then the social impact assessment is just routinely conducted, while the health impact assessment is not routinely conducted. And I think that one of the important aspects is, again, dialogue among different experts, where one can help the other to ensure that all the issues are properly addressed.
I have nothing to add to that. Francesca dealt with all the points. I think the key thing is that this document is for the EIA Directive, and that doesn't specify social impact assessment. It talks about population, and the way in which population is interpreted in different member states will vary. And it might be that for some projects and in some member states that that aspects of social impact assessment are more important. But this document focuses very much on health in EIA, and it makes the strong case for the broad definition of health to be addressed. So social issues will be important, as well as economic and physical issues as well.
Well, thank you very much to all the presenters today. Thank you to Sarah and Brigitte for moderating all of those questions. I'm sure that there were many questions we didn't have time to get to. So a great discussion, great participation. Our presenters today have kindly put together a page for references, which will be included in the slides. And when you exit the webinar today, you will be asked to complete a brief survey about the webinar, and we just hope that you will take a few minutes to do that to help us improve our offerings to you for IAIA for future webinars. You will also receive in a couple days a link to the recording and to the slides, and as well as those references, they will also be included in there. And we also will include in the link that you receive the link to the feedback survey, so that you have an opportunity to provide that feedback by January 6th. So we really do appreciate all of your contributions there to help us. And so as we're all closing out our webcams and getting ready to end the webinar, we just want to thank you for participating. We know your time is valuable, and we hope this webinar was valuable to you. See you next time.